I'm Faluyi Adedoyin-Oluwakemi Oluwaseun. I'm the Reproductive Health and Family Planning Manager for Ifako-Ijayi Local Government. I also work as QA mentor for Project Aisha, covering some private facilities and public facilities in the Ifako-Ijayi Local Government area. When I visit facilities, one of the things I look out for is the performance of maternal indicators in antenatal care, labor and delivery, referral, and family planning.
My name is Matron Unsu Omolara. I work with AB10 Specialist Hospital. Project Aisha have been helpful in improving labor and delivery services in our facilities since the inception of the project. Every month, the QI mentor visits our facility to provide on-site support.
Today's visit in a private facility, looking at Pathograph, which is a scientific tool designed in monitoring progress of labor and delivery. During the quality improvement meeting, I was able to identify some gaps in some of the Pathograph field. Gaps addressed, I retrained the whole staff on correct use of Pathograph.
One of the areas we looked at today was the correct use of Pathograph, where she highlighted the importance of periodic and timely measurement of fetal heart rates, cervical dilatation, hourly vital signs of mother and child, as well as monitoring the mother and child after delivery.
Training was done for the newly employed midwife, after which I reviewed the documentation practices around the maternal key indicators mentioned earlier. As a mentor, I applauded them where they are doing well and gathered them on areas where some gaps were noticed. And at the end of every visit, I ensured that everyone has a reflection of what they are to do after the meeting.
All the mentors' efforts have shown consistent improvements in the delivery of our services.
The activities and visits of the Quality Improvement Mentor is to further the goal of Project Aisha, which is to ensure that both mother and child are safe.